Welcome participants to today's panel discussion hosted by Meditationz Media Network and the Holistic Life Portal. I am Faishatel Mondesi, the discussion moderator. The topic of focus is treatment for SARS, the Ivermectin option. Joining me are Dr. Gilbertha St, Dermatologist, Herbalist, Integrative Health Care Specialist, and Managing Director of Eden Herbs, alongside panelists Ashwin Chandrasekar, Postgraduate in Pharmacology, M.Pharm India, and Master's degree holder in Management and International Trade, and also Mr. Robert Kerr, Biologist, Regional Advisor and Consultant in Integrated Urban and Rural Development.
Yes, okay. What the point I was making is that whenever we scapegoat the wrong thing as the causative agent, we allow the serial killer to continue, and we will. And a good indicator is for those diseases that we can never seem to cure, like cancer. You know, some leukemias they blame on a virus. HIV, it has long been now proven that HIV does not cause AIDS, but the public doesn't know. And measles and so on. So the significance of this is very relevant for what we have happening now with the coronavirus. That is, they have not isolated, and by isolation, there are bona fide scientific methods for isolating organisms of this type, is centrifugal and filtration, and always a control. This has been the failure in the virus narrative, is that they have done these things without control. And they consider extracting the thing from a person and either growing it in vitro or in vero, that is in other tissues, has been the basis of identification and isolation. And that cannot be. You can't isolate something mixed up with other stuff. So I have presented these links for persons to do their own research. Right? And the PCR test, despite even their own admittance of inaccuracies, is being used as a basis for people's personal freedom and movements to be regulated or controlled. And that is certainly far from being on the shadow of a doubt. You're supposed to only be guilty when there's no even shadow of a doubt. And the PCR test is far from being without such a doubt. So I raise these points and I've put the link there for people to I know it reaches the traditional paradigm of thought, but we have to go with the scientific evidence that is there. And so I make these points, and I will speak further about the vaccines, because in fact, what they're offering in all the cases, well, all the popular vaccines, is not a vaccine in the sense. Not everything you get in a needle is a vaccine. My understanding is that vaccines work by generating a weakened form of toxic parts of the tissue material. Toxic, I'm not using the word virus, toxic elements, toxic cells, and thereby triggering immune response from the body. That's the traditional way that the vaccines work. But in the case of these new vaccines, they are instructing the body to become factories for viral, or I use the word toxic proteins, so as to stimulate an immune response. So it's two different systems altogether. They are taking over the instructions in all the cellular factories in your body to produce viral proteins. So in the case of Jamaica, we're getting AstraZeneca. And most people, I would say 99% of the people don't know what is in the vaccine, which again is a breach of the Nuremberg Code for informed consent. What is in the vaccine? The manufacturers tell you what is in their vaccine if you go to these special documents. It's a chimpanzee virus that's been weakened. it has genetically modified organisms, which they will not disclose what those are because they're proprietary information, and other preservatives and other elements in it. No, people don't know this. Why should somebody who is virus free inject themselves with a mechanism to manufacture viral proteins? It doesn't make sense. Secondly, um, those people who have caught the SARS, who demonstrate the SARS symptoms, probably have developed immunity. Not probably, they have developed immunity. So why is this rush to vaccinate people who don't have the virus, are healthy, and people who have developed immunity, when in fact there are treatments that are prophylaxis in their own right, like ivermectin, HCQ, as hydroxychloroquine, and interferon alpha that could treat people and therefore not warrant the lockdowns and all the various measures that they are pushing. Why not use the treatments, right? Why vaccinate healthy people? Why vaccinate people who have developed immunity to the SARS disease? Those are just my comments.
All right, thank you so much for that, Mr. Kerr. Ashwin, are you ready to present?
Yes.
Thank you.
Yes. Myself, Ashwin Chandrasekar. I'm a pharmacologist from India. I have been in the pharmaceutical industry for the last 15 years. My experience is in the field of regulatory affairs, manufacturing of pharmaceuticals, quality control and quality assurance. And I have also been a part of pharmaceutical exports from India to various parts of the world, such as to start with Caribbean islands. I worked in most of the Caribbean islands, Eastern Caribbean islands, Jamaica, Haiti, Dominican Republic. I have worked in South America, and very recently I was working in Africa. After professor in the Department of Pharmacology in BLD Medical College. First of all, I thank Dr. Rose, Dr. St. Rose for giving me an opportunity to talk in this regard when it comes to ivermectin as a potential drug for the treatment and prophylaxis of COVID-19. Yes. So to start up, I want to mention this one very important point which Dr. St. Rose had mentioned, which is regarding repurposing of drug. Let me give two examples of a very good repurposing of drug. The number one drug which I want to tell is regarding aspirin. Aspirin was a drug initially started to be marketed as a anti-inflammatory, which is a non-steroidal anti-inflammatory drug. Later, it was found that it is a thrombolytic, and the purpose of aspirin is now more thrombolytic than a anti-inflammatory. So you can understand the various things a drug can undergo in its lifetime. The number two drug which I want to mention is Minoxidil, which is an anti-hypertensive when it was introduced, and now it is being used as a for the treatment of male pattern baldness, because it increases the uh, uh, it increases the hairs in the patients who have this increased hormone levels. So there is a wide chance that the ivermectin can also be in this line, because even before COVID-19, ivermectin was found to be very effective in various viral diseases. For example, it was very, very useful in Zika virus, dengue. Then it was told it is also useful for the treatment of Venezuelan encephalitis. And also in some parts of the world, it was being used for treating like avian influenza. So it has the antiviral property. So that is why it was used for various viral diseases. Now comes the COVID-19. So it is just about 1.5 years, about 12, 15 months. So till now, we are not able to pull out any great clinical trials because of the time frame, but we are able to give a good answer in vitro. In vitro, in the sense, it is outside the body. There is a lot of time for us to evaluate the in vivo studies, but in vitro studies proves that ivermectin can be a potential drug, not only for the treatment, but also as a prophylactic, as Dr. Robert Ken was telling. Why do we have to push every patient to take the vaccine? So we need to have a wider approach while treating COVID-19. This is what I feel. These two examples are going to be uh, uh, throwing light about ivermectin's role, not only as a anti-parasitic, which is approved by the FDA, but also it can be a antiviral agent because it has been time tested and it is safe for 35 years. It has been in the market. So this is what I want to start my discussion in the initial, and then I can talk about the various trials later on. Back to you.
Okay, thank you very much, Ashwin. Dr. St.Rose, do you need to add anything to what he said?
Yes. Can I make a comment, Faye?
Sure you can.
Yes, okay, thank you very much. Thanks for your input, Ashwin, and with all your knowledge and experience. You know, you're one of those that know so much of the pharmacology and the way the ivermectin works.
Yes.
And it's people like you we rely on to tell us what's happening at the cellular level, and myself, you know, take that information to the clinical level. I want to comment on what Robert says about identification of the virus, the measles virus. He spoke of that paper, which I guess we will read. And even now for this COVID-19 infection, you know, there's a lot of controversy as to if it's a real virus, where it originated. But of course, we know, you know, there's something causing an effect. And this is what we're working on. We will consider, you know, other things after, but in terms of having an entity which is causing that COVID-19 infection that they've named it, is what we're dealing with. So we're happy to have the ivermectin to do that. The other point to Robert spoke of was the way technology is being used. And, you know, the two ladies who won the Nobel Prize last year, I wasn't aware of it. Thanks for the information. And we know how now, you know, our whole body is being manipulated. There's so much manipulated. So when we speak of genetically modifying, it's not just food anymore, you know, so they can actually modify our food, and it can in turn come to modify what's happening inside of us. But also, you know, the vaccine, to me, I don't have all the details, but my apprehension and my thinking that doesn't come with all the facts tells me that this vaccine has entities to manipulate, you know, how we operate, not just our genes, but, you know, other aspects. So I think we need to educate our people of that possibility and, you know, give them the alternative of ivermectin, which we are showing to be so far more superior in what the vaccine has to offer. And I just take a little 5 minutes there to speak of how we use the ivermectin. So ivermectin is available in St. Lucia. I know it's available in Jamaica, but although the medical association, the members there wanting to use it, Robert, I think, you know, it's not quite rolled out. And it's unfortunate, as that happens, people are dying, you know, while they wait and do what or nothing. But we must, you know, become aware of the world we are in now. I think it's very important to be aware and be mindful, because the world we are in now, it's not totally geared for health and healing of our people. And that's the unfortunate reality. A few days ago, I woke out of my bed and what came to me was, you know, it's a battle against persons wanting to make money, persons wanting to control, and persons want to create more disease. And myself as a physician, I see it all the time. Our food is being poisoned, and you know, some drugs that we are given create more diseases just to keep a pharmaceutical industry going. And I will say it because it's the truth. And I'm not afraid to speak truth. And I would like people to be aware. In fact, you know, when I woke up a few days ago, I said, you know, we really need to come to a position where, you know, we can just be so self-reliant in terms of looking at what nature has given us. And we, luckily in St. Lucia, Jamaica, the Caribbean, and some other places, you can be self-sufficient in terms of eating the right foods. And if we look at the other basic aspects of health, then, you know, we won't go down the slippery slope of needing too many pharmaceuticals. And then when we come to look at our herbs, and I'm happy and I'm proud that I've put together Eden Herbs, which, you know, has a line of products for doing basic things for the body: detoxify, nourish, get rid of inflammation. So in fact, I was saying we don't need so many herbs to keep us going. We just have to eat healthy and then, you know, practice the love, the trust in God. And even WHO speaks of the definition of health, a state of physical, mental, emotional, social, and remember the spiritual well-being, because the spiritual well-being is very, very important at this time, because this is what will help us in the battle that we are in there now. So it's not just a battle of vaccines and medication, but a battle of control and a battle of just creating more disease to keep people in captivity. But I wanted to tell you about ivermectin. So ivermectin, we have it in tablet form. In tablet form, the way it's used, you have two loading doses. You take a dose on day 1 and another dose on day 3. If you have had the viral infection or whatever infection, you take another dose on day 6 and day 8 if you still have symptoms. So you always start with the 2 doses, 2 days apart, and then you do another on the 6th and 8th day if you still have infection. Remember the importance of working out the dose for yourself. We do it 0.2 milligrams per kilogram. And then you proceed to take doses that will keep you from getting the infection. So in frontline workers like myself, my staff, we take a dose every week. So your doses work out. So unless your weight changes drastically, that remains your dose. And you take a dose of 1 dose a week. Now, some people who hardly go out or hardly mingle might want to take it every 14 days, 30 days, or they might just want to hold some tablets, hold it there. If you feel you got something, you knock it off. So this is the way we use the ivermectin. And for me, I'm proud, I'm happy that, you know, I've been using it for 2 months now. And I can feel free to walk about without my mask and, you know, see my patients and have no fear of getting any infection. So I thank God for ivermectin, and this is why I'd like to spread the word, share the word, and also have people be mindful of, you know, the things that they are doing to protect themselves. And there are some people who will say, okay, I'll eat healthy, I'll take my other herbs, immune system, and so that can work. Depends on your level of exposure. So that too is important. And of course, that's the basic of good health.
Thank you very much for that, Dr. St.Rose. Either Mr. Kerr or Ashwin, do you have anything you want to say at this point?
A quick comment, if I may, Faye, is the whole drive for vaccine just seems unreal. I mean, and Dr. Rose, you're right. This is really a spiritual issue. Spiritual health and your body are all interwoven. This is really a spiritual issue. And one of the things we are to watch out for, are a couple of things we are to look out for and to be very alert. First one is to want to make the vaccination mandatory. They are testing the waters with this in every country. As a precursor to that is the question of vaccine certificates. You know, in Israel now, most of the people have been vaccinated and they issue a vaccine certificate, which allows them to go to bars, travel around, and to be mobile outside of the various protocols. So we have to be on the alert for that. That is really overstepping the boundary now of rights and freedom. As a precursor to mandatory vaccination, you will begin to see things like, people who are not vaccinated begin to be discriminated against. They can't go to certain places, they can't buy, they can't go in. Just as how you have your mask now, the mask was a preparatory stage for this. So we have to be very much on the lookout for anything like that. So once you see that, you know that we are heading in a certain direction. And it's really illegal, I would think, as far as your constitutional rights are concerned.
Thank you for that information, Mr. Kerr. Ashwin, would you like to add to that?
Yes, I would like to add on the pathophysiology of this virus and how ivermectin is going to work on that when compared with the vaccine. So first of all, for this SARS-CoV-2, that is the novel coronavirus, to infect, to cause problem, first of all, it has to infect the cell. In cellular level, it has to infect the cell. And after which, what happens, the novel coronavirus has to enter into the nucleus by action of the cargo protein, which is in the cytoplasm. So what happens is the novel coronavirus binds with this cargo protein and tears the nuclear pore complex and enters into the nucleus, where it replicates and causes the damage. So there are two options now. One is, as you all know, the vaccine is already out. So what we do is we vaccinate the people and trigger the immune response, and thereby the body is having the antibodies. So this is one option, which to me is why do we trigger the immune response if a person is not already affected? This is one point. The second is regarding ivermectin. The ivermectin does not trigger the immune response, or it does not act on the novel coronavirus per se. It does not do anything to the novel coronavirus, but it binds to the cargo protein and does not allow the virus to enter the nucleus. So what happens is the virus is in the cytoplasm, the novel coronavirus or the SARS-CoV-2 is in the cytoplasm, which is killed by the natural ability of the cells, like phagocytosis or natural killer cells, the immune response, which we like, for example, intercellular killing. So what happens? We are able to fight the disease with help of ivermectin, and we do not need to trigger any antibodies. So this is a great opportunity for building our immunity, and also ivermectin will be effective in all the strains because we are not going to target the virus, we are targeting the cargo protein. So I think it is an excellent opportunity to build immunity with ivermectin and other supplements like zinc, vitamin C, vitamin D3. I think this is what I want to share with the group.
If I may comment on Ashwin's points there. You know, the mRNA, messenger RNA vaccine, for example, the Moderna vaccine, that is going to alter the cell, the instructions for the cells that are manufacturing proteins in your body. They will actually be generating components of the viral proteins. He made a very important point about altering the physiology of the cells and so on. The big difference between the traditional vaccine approach and for example, the Moderna is very important. And you will hear in the mainstream media that they are only affecting the DNA and RNA activity outside of the nucleus. And therefore, they are not engineering change in your genome. But that is really just a sleight of the hand trick. There's constant communication between the RNA molecules outside of the nucleus and inside of the nucleus. And there are memory T cells, some of the some of the protective cells in your body that retain long-term memory. Those are outside of the nucleus, right? So to say that they are not affecting your genome is not true, because memory is both coded inside and outside of the nucleus. And if they are altering the long-term memory cells, they are in fact changing your genome. And we have to trust that what they are saying is true, that they will not be editing in the nucleus. But indirectly, there's direct communication between those nucleic acids inside and outside of the nucleus. It's a two-way street. So there's a lot of deceptive talk going around. And I mean, your immune system is a very complicated and sophisticated mechanism with lots of feedback and what they call pleomorphism, where cells change based on the acidity and the conditions in the fluids. So it's people need to be very careful. If you are in doubt about this thing, think twice.
Could I ask a question?
Yes, you can. Go ahead.
Gail Defoe, I think Dr. St.Rose knows me. I'd like to clarify something the speaker before last said. That was speaking about the protein in the cell that binds, the cargo protein that binds the ivermectin, that allows that binds that protein, that does not allow the virus to actually spread, or in this case, where the virus would have gone to our DNA to replicate itself in order. What I wanted to know is, you mentioned about T cells being activated. We were talking about innate immunity. And I would imagine that is one of the reasons that ivermectin has to be acting so quickly, because it wouldn't be going to the adaptive immune system. It would only be dependent on what it was doing in the cytoplasm. So how then would you have had your TL1s and TL2s activated? Was ivermectin not doing anything else but binding cargo protein? What would have activated our TL1, TL2s? How would have the memory cells have come in? I'm a pathophysiologist, so I'm just interested in that answer.
Okay, do any one of our panelists want to respond to this question? Because let me just say, we have a question and answer segment toward the end, so I'm not sure. Yes.
Wait for that.
Yes,
So
Ashwin probably can take it at that point. He can
not a problem.
elaborate on it at that point.
So what we can do, we can actually address some questions now if the panelists choose to do so, or we can leave it for the toward the end, which is our third session. So Dr. St. Rose, Ashwin.
I can just try to answer some few points what the person was asking. Like, yes, the immunity, what we have is the innate and we have the adaptive. Yes, actually, what happens when from the way what I see, I can answer this, but others, if you can help me out, it will be great. Now, yes, the innate response will be not raising, not cascading the T lymphocytes and also the B lymphocytes. Says that is what the question was basically. Yes, because of that reason only, what happens is when ivermectin is given, the various activities of the cell, like the neutrophils, the NK cells, the macrophages, the monocytes, maybe they might be very useful by not affecting the T cells and the memory cells, because there is no much time for the virus to trigger the that is T lymphocytes and others, which causes the memory cells to cascade the reactions. So I think what ivermectin can do is, in a short term, it may block all the viruses and kill all the virus.
Thank you. I'll leave my next question for the question and answers period. Thank you for that.
Yeah.
Okay.
But
So
that's a very important point there, Faye, to elaborate on what Ashwin says. So the ivermectin, sort of works at two levels. And this is why patients get, such quick responses. And, persons that might give you testimonies of how quickly they got relief is based on the fact that, the ivermectin is a killer. It kills the virus right at the point of entry. And the way it kills the virus really is prevented it from entering into the cell, but it works there on the spot pretty quickly. But in addition to that, there is the sort of delayed activity, which is how Ashwin describes the immunity being sort of developed even as the ivermectin destroys the virus entering the cell. So it works at two levels, sort of immediate to prevent the virus from entering the cells. And so at the local level, the virus is destroyed by the local activity in the body, but there's also a sort of effect through the immune system, which is why you have the T cells and so. And this is why to the length of time that the ivermectin works in the body is like 6 days. So this is why we do the dose every 7 days for those who are frontline workers, because the effect of one dose will last 6 days. So having taken your dose on day, well, it's day 10, because you would have done day 1, day 3, and then day 10, starting your weekly protection, that effect of that dose will last you for 6 days. And this is why we repeat the dose on the 7th day.
all right. Okay, so thank you very much for those contributions. Right now, we're going to take another break, which is our second break. We're asking persons to put their thoughts together in terms of questions. Upon our return, we will all be free to ask Dr. St. Rose, Ashwin, as well as Mr. Kerr, whatever questions we have in mind.